midst of a lot of changes, or a lot of change. But I would say the biggest issue I had was I was faced with the fuel scarcity really, really fast. And so, a lot of the plans that was made, getting around things like that was heavily impacted as a result. I think that's probably one of the biggest challenge that we faced. Other things such as lights, I was pretty prepared for. And the mosquito bites, yeah, that was another major challenge. But I would say for me, from the perspective that we're speaking about, it was definitely the fuel scarcity. I think it's just being able to move around because I wasn't very familiar with the environment. Just really making sure that I was with the right people at the right time, always to make sure that I got to where I needed to get to was something that I struggled, because coming from the US, I mean, I was very familiar. Even if you were dropped in a new city, you can figure it out really quickly. But here, it was just, I just didn't expect how much that impacted me. I came in when there was a lot of change going on. There was economic change as far as where the Naira was at the time. There was fuel scarcity. And then there was just a different feel and vibe in the environment. But I would say, I think the biggest thing was the fuel scarcity. That was the biggest change that I experienced, just coming on ground, because we had a lot of plans, things to get accomplished, and we pretty much had to halt a bit because one, there wasn't a lot of movement that we could do. Things like electricity, I was used to it. I knew what I was coming into. Mosquitoes, that was the given. I brought a lot of mosquito repellents with me. But things such as the change in Forex and the fuel scarcity was something that we couldn't have anticipated what was going to happen. Because, in the States, I was very mobile. Even if I was in a new city, it's so easy to navigate and get around. But here, you had to exercise a lot of precaution. You had to be with the right people, which meant someone was always with me. And so that was probably one of the biggest thing. And then I would say another thing would be just the way of doing business here. There's certain expectations of doing business, whereas in the US it's very formal. You set a meeting, you set an agenda, you show up. Here it's very, very informal, and it can happen at different times during the day, weekend, and so that was another something I had to get really, really used to and plan to make sure that I can adapt pretty quickly but still get the same results that I was looking for. Majority of the hospitals already have some IT infrastructure in place. So now what we do is, how do we introduce technologies that help them optimize their processes? And so yes, in Lagos you do find a lot of that. There are also hospitals that are infrastructurally constrained. So then now we look at how can we also help them. So we introduced technologies for the doctor with maybe 2 or 3 nurses, all the way to 200-bed facilities. And so, yeah, there's definitely an awareness that technology needs to be a part of healthcare in order to, move it to the next era, because we can't operate in antiquated ways as we have been. But some of the things that we have to get past are some of the constraints, like I mentioned earlier, around power, internet connectivity, and sometimes infrastructure itself. Saddening what's going on, but I also think it's a great time to be here, because once you can ride this wave through the hard times and be forced to operate really, really lean and push your team really, really hard, and your clients are really appreciative that you haven't abandoned them, I think when things turn around, it'll be a lot easier, because I don't know if it's gonna get any I don't want to say worse, but I think we're there, so we can only go up from here. So for us, we've actually seen it as a great opportunity because we've learned and we've adapted really quickly and we've grown through the process. But for others, everyone has their reasons for leaving, but I would definitely always encourage everyone, if you're thinking about it, just really look at what value can you bring to your clients. And value can be a lot of things, but I feel like if you bring in value and the customer truly understands that, then you're going to be here for the long run. And Efferent, we really plan to be here for the long run. One of the good things about this administration is that they're making healthcare a priority. And so there's been discussions around, different initiatives for mother and, maternal and child care, universal health insurance. So we have been speaking to some state governments regarding how we can help them achieve some of their objectives, because you can't talk about healthcare these days without technology being a part of that. And so we're glad to be engaged by the government, and we're looking for opportunities to really bring our solutions to them. So yeah, that's been ongoing. Well, I would say that yes, I am still single because, like I said earlier, I came here to focus on Efferent. And, there's a lot of great people here in Nigeria, but, like I mentioned, Efferent takes about 90 to 99.9% of my time. And yes, it's been a great journey. Efferent is a healthcare IT advisory and outsourcing firm. What we specialize in partnering with developers, healthcare developers around the world that we feel their technology really can adapt and understand the constraints here in Nigeria. And so we are always out to introduce innovative solutions here in the market. To reach us, we have our website, www.efferentservices.com. I am on Twitter handle at Ezinne Anyanwu. I'm also on LinkedIn, also on Facebook, so feel free to follow us.
Instagram, so.
No, I'm not on Instagram. Unfortunately, I'm not on Instagram. But yes, please feel free. Send us an email, send us a text, WhatsApp us. It'll be great. We'd love to hear from everyone.